So welcome everyone. I'm Jim Erwin, chair of the Pierce Atwood Employment Practice Group, and with me this morning is my partner Katy Rand. We're going to be talking about what if COVID-19 strikes my employees and guests. We're going to be talking about some other issues that relate to that, so it's not just about the sick employee or guest, but that will be the meat of the program. I want to thank Hospitality Maine and Greg Dougal for making this opportunity available to you folks today, and we've got a lot to cover. So with that, I think we're going to get right to it. So our roadmap for this morning is, first of all, to talk about the basics of how you keep your workplace safe and how you show to someone who might come asking later on whether you did or didn't, show that you took reasonable steps to do so. Then we'll talk about what happens when someone contracts COVID-19 in a way that affects your workplace. We'll talk about enforcing rules. We'll talk about when employees are unable to work because of illness or other reasons related to COVID, and then we'll talk about liability. So I'm going to take the first issue and kick it off with discussing the critical steps that you need to do to keep your workplace or public accommodation safe. So let's start with just a kind of a basic step that businesses should have taken already, and something that you need to keep doing, which is creating and following an infectious disease preparedness and response plan. Now, I will say that the idea of creating an infectious disease and preparedness response plan sounds maybe a bit daunting. It is a very important element of what you should be doing, and we'll get to what that means in a minute. Your response plan is basically going to consist of the specific checklist requirements that have been prepared by the state, which are similar but more certainly detailed than what you will see from the CDC or OSHA. So that's going to be the meat of this plan. So you already know what the plan is supposed to say. The question is putting it together. Then you're going to need to train, which you would certainly have done if you were now open, and retrain your employees. You need to constantly reinforce the message. They communicate your expectations to employees. You need to do that with your guests, and then documentation. Documentation is a well, if you listen to us on any of our employment-related presentations, you almost always hear about documentation, the good and the evil, and in this case, it's good. It's important to do it. So let's first talk about what one of these plans really is. So OSHA has a framework called, you'll find it in publication 3990 on the OSHA website, called Guidance on Preparing Workforces for COVID-19. And this is the single most important step that businesses can take to create a safe workplace and be able to defend what you've done in the event that employees or customers or guests raise a question. We've got a template that will be made available to you after it'll be posted on our website, and I think available through Hospitality Maine as well, which walks you through the process of how you actually put on paper your infectious disease response plan. So the resources that you need for this, I've told you about the OSHA guidance. There's a supplement to that came out a few weeks ago, 4045. There are CDC guidelines. We're all immersed in those for sure. And then, of course, the specific checklists that are on the DECD website. But the important point here is that creating the plan is a valuable exercise. It creates discipline around how you think about what specifically your workplace needs you to do in order to implement the mitigating measures that we all know are so important. And then it becomes strong evidence of compliance in the event that OSHA investigates a complaint. And I should note that you probably haven't been hearing much about OSHA during the pandemic. because it's all in the state. But OSHA is, as we all know, is the federal agency that regulates workplace safety in most of the private sector. And the general duty clause in the OSH Act requires all employers to maintain a safe workplace. And OSHA is the only agency with authority to actually get a complaint, investigate a complaint, and then take enforcement action against any establishment. So it's not just a theoretical exercise to go through in order to have an OSHA compliant plan. It's your best defense to a legal challenge of almost any kind. And finally, where do many employees go when they're unhappy? They go to OSHA. So they're the ones that are going to be, they can put the target on your back, and you want to be ready for that. So in addition to OSHA, we obviously need to take account of state orders, and I'm sure you're all familiar with the ones that apply to your industry. But I think it's important to sort of try to bring those state orders, fold that concept into your preparedness and response plan. And as you know, the hospitality and restaurant, the lodging and restaurant checklists are very detailed, which is true of many other industry checklists that have appeared on the DECD website. And some of the detail is probably impossible or irrelevant to your establishment, but you got to go through it, and you got to pick out the ones that do apply, and then create evidence that those are what you're actually following in your workplace. So it's important to bring that in, those measures into your actual plan. I would say, I'm probably going out on a limb here a little bit, but I would say that if you do that, if you put in your plan all the checklist items that you are following, and you communicate that to your employees, and you have this written up that just show, here's how we dealt with a pandemic, it's going to be almost impossible for someone to show liability on your part for the consequences of what you did or what they say you didn't do to protect them. So really, really good defense to all of this. Now, I mentioned earlier communication, and I want to just reemphasize that you can't do it enough. And here's a long list of reasons why you should do it. I won't read through the list, but I just want you to have that and think about whether you're thinking about communicating about the mitigating measures that are in your plan in a way that is constantly reinforcing that message to every audience to whom it is relevant. So that's just a quick overview on the plan part of this. And now I'm going to turn it over to Katie, who's going to talk about what happens when an employee or guest gets sick.
All right. Thank you. So step one, dealing with the actual employee or guest who is sick is in some ways the simplest part, I would say. If somebody gets sick and they're an employee or a vendor or a guest, but they're in the workplace, you need to isolate them. If it's an employee, they need to go home. If it's a guest, they need to go to their room. If either of them are having severe symptoms, they ought to go to a healthcare facility or call their healthcare provider. So isolation is step one. Obviously cleaning and disinfecting. You'll have to think through all of the areas that the guest or the employee or the vendor touched and had physical contact with. Disinfect those areas, and the CDC recommends that you do that a second time, 24 hours later, not sooner than that. And then comes the harder part that we're going to get into in a minute, which is figuring out how large the circle is, how much impact that sick or COVID positive individual has had on other people in the workplace. And I think in some ways that's the more complicated stuff. But before we get to that, let's stick with the employee who's not well or who has tested positive. How long do they need to be out of work? There are two options that the Maine CDC has set forward. The first option is what we call a time-based option. So if the employee, if at least 10 days have passed since they first began experiencing symptoms, or 10 days from a positive test if they're an asymptomatic individual. Also no fever for 3 days, and that's, without the use of Advil or Tylenol or other fever controlling medications. And if they have any other symptoms, they've been improving for at least 3 days. So fever-free, 10 days since the beginning of symptoms, and they're better, is the time-based in a nutshell. The other option is a test-based approach. And so that individual would need no fever without meds. Their other symptoms would have improved. And they have 2 separate COVID-19 laboratory tests. It doesn't say it here, but obviously they need to be negative, administered at least 24 hours apart. So those are the two paths to getting somebody who's tested positive or who has had symptoms to return. And what that means practically is that somebody who does not get a test and is experiencing symptoms needs to be out of work for at least until they're better and 10 days after the symptoms, and also, or could choose to get a test, and when their fever and symptoms improve, could return after 2 tests. So, okay, the more complicated part, I think, what about all the other people that have had contact with that person? And there's a really important distinction, at least the CDC recognizes one, between contact and close contact. And the definition of close contact is actually fairly narrow. And what it means is that somebody has been within 6 feet for 15 minutes or more of somebody who is experiencing COVID-like symptoms in the period from 2 days before those symptoms start until they meet the criteria that we just talked about for ending self-isolation, or obviously a person who's tested positive. So 6 feet, 15 minutes or more. There's a lot of fear and misinformation around the need to quarantine when something less than close contact has occurred. But the Maine CDC says that quarantine is not required for people who are within 6 feet for fewer than 15 minutes, who are in the same room at the same time with somebody, but not within 6 feet, or for people who have shared space, but not at the same time. So somebody who's tested positive is in a room, leaves the room, and another individual comes into the room. And that's not to say that there's no risk of contracting COVID in those situations, but close contact is what the Maine CDC is concerned about when they are tracing and asking people to quarantine. So speaking of tracing, I've had a lot of clients ask, whose job is it? You have an employee who reports that they've tested positive. Whose job is it to make sure that that information gets to the state? Whose job is it to figure out, who they've been in contact with, et cetera? And the short answer is that it is the Maine CDC's job primarily, and they will take that responsibility. And so the Maine CDC is automatically notified when an individual tests positive. They're notified by the lab. The Maine CDC will also contact you, if you, the employer, if one of your employees tests positive. That's part of their contact tracing that they'll do. They will look at contacts that the positive individual, the individual who tests positive, had at work, outside of work, and they'll instruct those who've had close contacts to self-quarantine. So while the CDC is doing that, I don't have a great sense of how quickly I think they do it fairly quickly, but we also recommend that you as an employer, if you get notice that someone has tested positive in the workplace, that you try to identify who the other employees are that have had close contact with that individual. When you, and let them know that and advise them to self-quarantine. When you do that, it's really critical that you not share the identity of somebody who has tested positive or is experiencing symptoms. The ADA provides protections for medical information like that, and that would be an ADA violation. And that's true even if it's a small workplace and everybody knows who the individual is who tested positive. That name should not escape your lips. And then the question is whether a broader communication is appropriate. word will get out, employees will be fearful, and it might be appropriate to send a broader communication to the workplace, or frankly, in some cases, some sort of a public statement, depending on how public that positive test has been made. We've seen in the news recently a lot of news about certain establishments that have had positive tests, and a broader communication to sort of restore confidence and explain what it is that you've done, whether that's quarantining individuals, additional sanitation, etc. So this is what the CDC recommends for people who have had close contact. And this is what they're going to tell your employees when they call them and say you were within, you had close contact with someone who tested positive. They're going to tell that individual that they need to self-quarantine for 2 weeks from the date that they last had close contact. And that's of an individual who tested positive. You might wonder, well, can't we avoid this 2-week quarantine if all of these individuals who had close contact go get a test and are negative? Can't we just shortcut the 2-week quarantine? And according to the Maine CDC, the answer to that would be no. And the reason, as it's been explained to me, is that there is a lack of information around how long must pass between exposure and testing for the test to register that positive result. And they believe it could be as long as a week. And for that reason, the Maine CDC's position is that a negative test results will do nothing. It won't allow the employee to shorten that 2-week quarantine or forego it. Interestingly, the Maine CDC does not presently have recommendations for individuals who've had close contact with somebody who's experiencing symptoms but hasn't been tested. Presumably, most individuals who are experiencing symptoms of COVID, especially with expanded availability of testing, will choose to undergo a test. And for purposes of your business, advising the employees or requiring the employees who had close contact with somebody who appears to have COVID might be a good idea, but I throw that out there because that is the CDC's position. For many industries, but I would say perhaps yours more than any other, of significant concern is the amount of contact that employees have with each other outside the workplace. And I'll share with you that I have a very close friend who operates an establishment where there was a positive test recently, and the CDC did everything that I just explained on the last slide that they would do. And significantly more people in that workplace were required or advised to quarantine because they had close contact with the positive individual outside of work than inside of work. The workplace was set up so that it was not that difficult to keep people 6 feet apart. And so the close contact in the workplace was very limited. However, there were a number of employees who were roommates, who carpooled to work together, who went to restaurants together and sat across the table from each other on the weekends, who had parties at each other's apartments. And because of those relationships outside of work among the workforce, the practical result was that my friend lost his entire workforce as they had to self-quarantine for 2 weeks, which has resulted in a closure of that business. Now, the Maine CDC did not direct that business to close, and I'm not sure they ever would direct a business to close unless the positive results were, so large that the business couldn't operate. It's that practical consequence of close contact and the chain of close contact outside of work and inside of work that can really push much of your or most of your workforce onto a 2-week quarantine and make it difficult for you to operate. Now, I don't know that there's much that you as an employer can do to control who your employees socialize with. I do recommend and think that it's advisable to have a conversation with the workforce so that they understand that the failure to socially distance outside of work or to observe, the recommended protocol can have consequences inside of work. And to the extent they bring COVID in the workplace or have close contact with somebody who has COVID and therefore need to quarantine, that's going to mean that they're out of work for a period of time. And we're going to talk about out of work in a few minutes. The other, and I won't go into much detail about this, but the other thing to just sort of think about and be aware of are employee vacations, and the extent to which employees may be traveling to places that will require them to quarantine. That's a little bit different than sort of socializing, trying to control individuals' freedom to socialize with their friends. And you know, there is a certain quarantine at the other end of traveling to certain hotspots. And so that's something that at the very least you should be talking about with your employees if you have a workforce that travels on the weekends or takes vacations. You know, after what I just said about tests not cutting short the 2-week quarantine, you may be wondering whether tests are sort of the solution that they've been touted to be, and I think that would be that's a reasonable question. But it is definitely worth noting that just this week, the Mills administration announced expanded swab and send testing sites. Tests are through the executive order to be available to hospitality workers who could have been exposed without the need for a physician test order. And so at least theoretically, testing should be readily available to your workforce. But the reports are that the timing of results is really variable, from a couple of days to more than a week. And as I said, it doesn't cut the quarantine short. When you look at the infectious disease preparedness plan model, if you do, you'll see that this is addressed in there. And the point here is just that you need to know what's going on with your employees so that you can take appropriate steps. You need to know if they're sick and obviously direct them to stay home. You need to know if there's a positive test or if they've had close contact with someone who's tested positive. If one of your employees gets a call from the Maine CDC's epidemiologist that they're directed to self-quarantine because they were at a party last week with somebody, you need to know that. And they may be reluctant to tell you that. They may be interested in continuing to come to work, which is why it's really important that you have this requirement in place. Speaking of requirements, I'll turn it over now to Jim to talk a little bit about how to enforce the rules.
So thank you, Katie. A couple of quick thoughts on what you just said. One is on the last point you made that, and this goes back to the whole issue of communication. If one way to try to forestall or limit the risk associated with what your employees' out of work behavior could do at bringing into your workforce, your workplace, and creating your risk for you, is to be open about the risks and explain to them that, you know, great that you guys are all friends, but we could all be out of work if you are partying and socializing and not distancing. If somebody gets sick, everybody's going to have to quarantine, and that's just a really big threat. And I think the best thing to do is be open about that risk. The other thing I would mention is we sent out an alert maybe a week or 10 days ago called "Where I Spent My Summer Vacation," on this very issue of people who vacation. Now, for many of you in your industry, you don't have people taking vacations in the summer. It may not be an issue, but it's on our website if that is of interest. Now, so let's talk a little bit about, so you've got the rules for your employees, rules for your guests, etc. But what do you do about enforcing them, and how do you deal with that? So with regard to employees, our advice has long been, since the very beginning of this, is that once you have your protocols in place in your response plan, you have got to make sure that people follow them. So you can't let it go. You can't let it go because, well, it doesn't happen that often, or it was only for a few minutes, or there's going to be lots of stuff on the margin that's maybe not in and of itself a big risk, and not flaunting the rules, but you really need to drive home the need to just, these are to be followed, no ifs, ands, or buts, and you have to be willing to discipline people who won't do it, and we know what the risks are, so we don't need to go into that, but I would just simply say, if people think your rules and protocols are just for show and they're not actually meant to be followed in order to actually reduce the risk of infection, then it'll just erode over time. So so that's just a hard thing that you have to do. Now, obviously guests are a different story. They're paying customers. They're not there very long. You know, who's going to notice if guests are wandering around in the restaurant without a mask, et cetera. So maybe the risk is low, but by the same token, if you let guests not follow the rules you tell them they need to follow, they're not going to follow them, and that also will erode compliance, which is a bad thing. So you just have to use more diplomacy about that. But it's still the same principle applies. The whole thing will go south if you don't enforce it. So I know masks are a big issue, and it's a challenge, particularly in the hospitality industry, to have to enforce the mask rules. But as we know from the executive order that came out in early July, number 2 for this fiscal year, it requires businesses to implement measures requiring customers to wear face masks. So it includes all restaurants and lodgings, and it includes all coastal counties except Washington County, and the cities of Lewiston, Auburn, Augusta, Bangor, and Brewer. So to be in compliance, your rule has to be no mask equals no service. And there's no ambiguity about that. That has to be the rule. But then the question is, okay, so it says you're supposed to implement measures. How far does it intend for you to go to do that? So while the order may not be ambiguous, but then the description of that, things start to break down a little. So the order says, for example, such measures may, for example, include denial or entry of service. Okay, well, so what does that mean? Does that mean you just ask nicely, and if they say I'm not doing it, you don't have to enforce it? I don't think that's what is intended, but it's an equivocation on the part of the state that's probably not helpful to establishments who just need to know what the rules are so they can follow them. You know, we obviously want to acknowledge it's clearly less comfortable to be confronting paying customers, especially when they're in short supply, over compliance with these rules. But I think despite the confusing nature of the direction from the state, our recommendation is you just have to do it. And so we'll talk for a minute about, you go to the next slide, Katie. Are you stuck? There we go. So Greg and I talked before a week or so ago about some guidance that is available on how to de-escalate tense situations. And I'm by no means an expert on that, but I think there's some common sense things you can do. And I've looked at that guidance, and I've just captured some ideas here around what to do when you have an angry customer or guest who just doesn't want to get with the program. And if you're the owner or the manager, it's going to kind of fall on you to sort this thing out. So there's some really common sense things that you would want to do. First of all, don't escalate the emotionality of the situation. Be as calm. You got to stay calm no matter what. And there's just some suggested things that you can say that may help sort of disarm the situation, and bring the person back down to a level where they're going to ultimately get to a point where they do what you ask. I think that it's entirely appropriate to say that while you wish nobody had to be wearing masks, right or wrong, this is what the governor has ordered. You can't risk your losing your license to operate, and you just don't have a choice. And your staff, if they got into a confrontation with someone who works for you, your staff was just doing what the law and the business requires them to do. Now, all that said, particularly with respect to masks, I think there's maybe a better approach than that. And my thought, and maybe many of you may have already thought of this, but my thought is make masks the new neckties. So we're familiar, or at least there used to be many establishments, not so many anymore, that required a necktie in order to patronize the establishment. And for people who didn't have them, they always had a necktie available that you could make the men would put on, so they would be in compliance. And it's a pretty simple step for you to do the same thing with masks. Now, this is applicable across the board, but I would say in particular with respect to restaurants where you have a limited exposure to people, they're only in there for a meal. You simply say, if they don't have a mask and if they aren't willing to go get one or didn't bring one or whatever, you just give them one. And there's an expense involved, no question about it, but it's a lot better to just make light of it and say, of course, we're happy to provide you with a mask for a few dollars, and just disarm the situation preemptively that way. For hotels, it's a little more complicated because people are around longer in more locations, and in many of those locations, they need to be masked. And so I would make a virtue of necessity here and actually market that you have masks available and you will provide everybody with a mask. And so that people know when they show up that you're serious about it, but you're nice about it, and you're going to provide them with a mask. And that's just the way it's going to be. So to me, that gets you out in front of the ugly situation where a customer or a guest just simply doesn't want to do it and is arguing with someone about, well, I don't have to wear it here, I only have to wear it there, or any of that. Just say, look, here's the deal, and here's the mask. Maybe you even put them in the rooms when they arrive. They're sitting there, waiting there for them. So you use your imagination on this, have some fun with it, and get out ahead of that problem. And with that, I think we're ready to go back to Katie, who's going to talk about what to do when your employees are unable to work.
All right, thanks. This is a subject, especially the FFCRA, that could and has consumed full webinars. And so, you know, I can't get into the weeds, but I also don't want to assume that everybody participating is familiar, because to the extent for businesses that have been open all spring, they had to get familiar with some of these laws, you know, in March and April, and many of their employees have churned through the leave that's available to them under the law. That's not necessarily true for this audience, and so I don't want to assume you're familiar. There are so many reasons that employees may not be returning when you're asking them to return, or might return for a little while and then tell you that they can no longer work. Some are directly related to COVID and illness. Some are a little bit more vague, generalized fear or anxiety. Somebody in the family is vulnerable, so if employee brings it home, that individual will really likely experience an adverse outcome. And childcare is obviously a huge one, and it's still a huge one even though the schools are out, because a lot of employees count on camps or, you know, summer rec programs, and some of those are running, but many of them are not. I call unemployment the elephant in the room, or the elephant in the Zoom, because it's sort of looming behind these issues that employees who have not been working, either because you've been closed or maybe because of these COVID-related reasons, may have been collecting what has been a very generous unemployment benefit. Obviously, the more generous that benefit is, the less attractive coming back to work is. And so I know that businesses view with some skepticism employees' refusal or inability to come back to work. And this issue is just sort of looming in the background. I don't have the answer for that. I just want to acknowledge it as a concern. But I don't think it affects sort of the way you as a business need to address the specific issues that an employee is articulating as a reason that they can't work. There are layered leave of absence obligations. There are a number of different statutes that could come into play or might not, depending on the reason that the employee can't work. And I'll cover most of them. The first is this is a statute that's been on our books in Maine for a long time, but it's not one that we think of very often because it isn't triggered very often. And that is that we do have an extreme public health emergency leave statute. It doesn't, unlike FMLA, which has a set number of weeks or days, it's vague and it requires reasonable and necessary leave, doesn't need to be paid, if an employee needs leave for these reasons that are listed on the slide. And notably, they include being in quarantine or isolation. Notably, they include that you, employer, have asked this employee not to work to avoid exposing others. And notably, it includes that an employee is needed to provide care. Now, query whether that means medical care versus child care. That's not a question that the statute answers, and I don't know the answer. I think the thing to remember about this statute is that this leave does not need to be paid, and that you need to think long and hard before you terminate, as opposed to sort of make inactive and put off to the side an employee who can't work for one of these reasons or a COVID-related reason. There are some exceptions to this. You don't need to provide leave to somebody if you need to downsize. If the employee doesn't communicate with you, public employee services won't apply to you. So there are some exceptions. Now let's talk about FFCRA, the Families First Coronavirus Response Act. This went into effect on April 1st, 2020, but many of you were not open probably when that happened. It applies to employers with fewer than 500 employees. I'll talk in a minute about a small business exception that's very limited, but might apply sometimes. There are two different buckets of leave under the statute. There's 2 weeks of emergency paid sick leave. That's available for certain reasons, and the employee is either paid fully or at 2/3, depending on which reason. And so that's 2 weeks. And then there's an expanded FMLA that covers individuals who are unable to work for childcare reasons, and that's 2/3 pay. And that's available, that's the FMLA leave. It's an additional 10 weeks, but if an employee has previously used FMLA, that'll eat into that amount. Really important, the amounts that you pay an employee for leave under this statute are going to come back to you. This is essentially free leave to you, even if you have to advance it. You get that money back through a payroll tax credit. I'll talk in a minute about that as well. So here are the reasons that paid sick leave could be available. The first 3 reasons relate to the employee not being able to work because of something that's happened to them, right? Quarantine, healthcare provider told them to isolate, they're sick and are getting a diagnosis. And the last 3 reasons relate to the employee taking care of someone else. Somebody else that they have to care for is having a quarantine, childcare. The amount of paid leave is for a full-time employee is 2 weeks, 80 hours. And part-time employees get 2 weeks of leave, a pro rata amount, whatever their average work week is. This leave, if it's taken for those first 3 reasons for self, is paid at their regular rate, 100%, capped at $511 a day. If it's taken to care for somebody else, it's paid at 2/3 the regular rate, but capped at $200 a day. And important for this audience, really important for this audience, regular rate, remember, you probably all know that regular rate is a concept that comes up in overtime calculation a lot, and there are some wonky rules around how to calculate regular rate for your tipped employees. So, you need to put the tip credit back in, you need to add service charges back in. That's a whole nother webinar, but I just really want to flag that for you. Be careful that you're using the correct regular rate when you pay this leave. And then the second component is this expanded FMLA, which is available for one reason only, and that's to care for a child whose school or childcare is closed due to COVID, and that's at 2/3. These do not, unlike the typical, the traditional FMLA that you're used to, if it applies to you, under which an employee needs to have been employed with you for 1 year in order to be eligible. This expanded FMLA applies to people who have worked for you for only 30 calendar days before leave. And note that if they worked for you earlier in the year, were laid off for a while, and have only been back for the last 2 weeks, they will qualify for that leave as long as they have 30 calendar days, okay? The way the statute works is it looks at dovetailing the emergency paid sick leave with this expanded FMLA, and so it contemplates that the first 10 days someone is out for childcare reasons, they would use their paid sick leave, which I just went over, would be paid at 2/3, and thereafter this expanded FMLA would kick in. So that's up to 12 weeks of paid leave at 2/3 for childcare related reasons. There is a small business exception that's important, but it's narrow. So if you have fewer than 50 employees, you can be exempted from the childcare related leave only. So there's no way to exempt yourself from that paid sick leave to the extent it's for an employee who needs to quarantine or is ill, et cetera. It's just the childcare portion. If an authorized officer of your business can determine and document, certify, that providing the leave would essentially put you underwater, that the employee that's seeking leave is so specialized and important to your business in a specialized way that you can't go on without them, or that you don't have enough workers to provide services that are needed for the business to operate at a minimal capacity. Note, though, that if the employee really can't work for childcare reasons, denying the leave just means that you've lost an employee. It doesn't necessarily solve the problem of not being able to run your business without that individual. Very important for this audience that has, some of which has not been open for a period of time, there's a posting requirement. The poster is available on the Department of Labor. There's a link here in this slide. You need to make sure, even if you intend to rely on that small business exception that I just talked about, you need to get the poster up or get it out to your employees somehow. The tax credits, because this is an important piece. The way you reimburse yourself for the amounts that you spend on FFCRA leave is by not paying over FICA payroll taxes. And you can do that on all of your employees until you have paid yourself back. So employee A is the only one who goes out on leave. They take 2 weeks of leave. You just hold back FICA payroll taxes on, your entire workforce if you need to, until you have covered the wages that you paid that employee. And if the payroll taxes aren't enough to cover the leave, then there's an adjustment when you file your quarterly taxes. Before I go over to liability, just a couple of, I mentioned on the layered leave slide, the FMLA and the ADA. Just because we have this new Families First with expanded FMLA does not mean that the old FMLA has no applicability. It does. If you have an employee who has a serious health condition, whether that's COVID or perhaps asthma, and is unable to work because of that serious health condition, perhaps they can't wear a mask and there's no other reasonable accommodation, perhaps their doctor says that they need to self-quarantine because of their serious health condition. If you are subject to FMLA, state, federal, or Maine FMLA, you ought to be following that process. The FMLA could apply there. And then just as in any other situation where an employee can't work and they don't have FMLA, the ADA is sort of the backstop there, and leave might be a reasonable accommodation under the ADA too, to the extent the employee needs leave for something that's a disability. So again, could take a whole hour and a half to talk about those issues, but hopefully that gives some background. Oops, back to liability. Turning back to Jim.
Okay, so our last topic that we wanted to talk about is liability risk for you, for your business. And in particular, the liability, the question that arises, what if someone gets sick? And we get this question a lot. It's an understandable area of concern for all kinds of employers, and it's maybe even a heightened concern for someone in the hospitality business who has so much a relatively intimate contact with so many members of the public. So let me give you a very clear and straight answer. It depends. It depends if we're going to break this down by types of categories of people and look at it that way, because there's two very different, there's a fork in the road, two very different ways of thinking about liability. One is for employees and the other is for everyone else. So with respect to employees, if someone contracts COVID at work, then it is a workers' compensation issue. And they would have to show a connection to work, but they do not have to show fault. So if you did everything you were supposed to do, and can you go back one, Katie?
Oh, sorry.
You did it's okay. If you did everything you were supposed to do, and they still got it, because nothing is perfect in this life, it wouldn't make any difference, because as you know, workers' comp is a no-fault program. What we understand from our workers' comp practitioners is that workers' comp insurers are simply accepting these claims without prejudice, which means that they're just paying them, but without relinquishing the opportunity to challenge them later if it turns into something more serious or evidence maybe emerges that it was clearly not true. But they're not turning these into contested proceedings. So if someone and in the vast majority of cases, the first week under comp doesn't get replacement anyway. So if employee misses a couple of weeks, you're talking about a week's compensation. It's clearly not worth the price to fight over something like that. So that's how those are being handled. Now, let's talk about everyone else, because that's where we get into the world of negligence, and that's a whole different analysis. Now, you all know as businesses that are open to the public that you have a duty of care to the people that you invite into your establishment. So your duty of care is to take reasonable steps to prevent reasonably foreseeable harm, and it's the failure to exercise that care that creates liability. Now, there has to be proof also that there's a causal relationship between your failure to exercise care and the harm, that is to say, the contracting of the disease. And then there has to be actual harm. There has to be something compensable, money, something you can remedy with money. So that's the basic negligence. Those are the elements of any negligent claim, and that's in general what would apply in this situation. So with guests, if we go to the next one, we would say that you would have a greater duty of care than you would for non-guests. You're encouraging them to come to your business. They're paying you. It's foreseeable that inviting the public in creates risk of COVID transmission. From basically, unless you've been living in a bubble somewhere, what people need to do to reduce the risk of spread of COVID. In fact, you have a plan, or will have a plan, that spells out all the steps that you would take. So you know that there's a risk, so you must use reasonable care to prevent the spread. And so that means rooms, it means eating places, it means any places in your business where your guests can go. You need to think through, how could they contract COVID if they were here? And what do I need to do to make that very unlikely? So with others, we would say that they still have a duty of care to people who walk in off the street, maybe they're visitors of your guests, maybe they're vendors, whoever they are. You still have a duty of care, but it's not at the same level in the sense that their time there is going to be much shorter. Their exposure to different environments where they could contract the virus is much less. But it's still foreseeable that even in the short time that they might be there, that there could be a risk of transmission. This is a reason why, for example, you would require anybody coming into your establishment to wear a mask. It helps reduce that risk. And but with regard to everyone else, I would just say if you're doing enough for your guests, you're doing enough for everyone else. So that's why we if you follow the plan as laid out for your industry, you don't have to worry much about differentiating between guests and others. So what then is reasonable care? Well, as I mentioned earlier, if you do all the things that OSHA guidance and CDC guidance and in particular your state industry checklists require, and then you also add into it the masking and the testing for people who are from hotspots, you are exercising reasonable care. And if you document that in a plan and train your people on it and enforce the rules, you are doing exactly what you need to do to avoid being liable if someone does get sick in your establishment. So this all sort of rolls up into, if you're doing the things that the authorities are telling you to do, you're also doing the things that are in your own self-interest to do in order to guard against claims and with liability. So a couple other quick points on this issue of liability. One is the question of insurance. And there are really two insurance areas of insurance here that may be relevant. One would be your general liability and the other would be business interruption insurance. Now, on the business interruption side, when this pandemic first broke, there was it was a hot issue amongst lawyers and insurance companies about whether or not exclusions for pandemics in business interruption insurance, which apparently my understanding is that they showed up right after the SARS epidemic in early 2000s. These exclusions started to show up around 2006. But there was people were trying to figure out, given the unforeseen and really significant harm caused by this pandemic, insurance companies have a lot of money. How do we get at it? And the theory is, well, it's not the pandemic that's caused the harm and the business interruption. It's the government orders in response to it. So that's the argument. There was a lot of posturing early on about people were going to go take that to the mat and make it work. I haven't seen any cases that have decided that yet. Don't know if there will be any. The point is, business interruption is probably, it's going to be a tough slog if you think you're going to get indemnification for lost income because of this. With regard to liability, you just need to look at your policy and see what it says. Is there an exclusion for disease or pandemics? Is there a way to fit this into a force majeure kind of argument? There may be coverage, and we haven't looked closely at that. We haven't had anybody who's had to try to invoke coverage in that situation. But clearly, if you're doing the reasonable care that we were just talking about, then whether you have insurance or not is not going to matter because you're not going to need it. And so that's where your focus really needs to be. And then the last thing I wanted to mention was this question of liability waivers. This is another area where we've gotten lots of questions over the last few months about should I make various classes of people sign a liability waiver when they want to do business with me. And, in some situations it makes sense. I have a serious question as to whether it makes sense in your business that you would ask your guests to sign a liability waiver. You don't ask them to waive a food poisoning claim. You don't ask them to waive a slip and fall claim. if you're asking them to waive a COVID claim, you're basically signaling to them that, you know, you're not a safe place for them to be, which is not obviously in your interest. And frankly, you know, there's bound to be litigation somewhere down the road to sort of test the validity of these things, because they're releasing future claims, and those things are the courts look, it's not impossible, but courts look at those very strictly. So when you look at the legal benefit from that and weigh it against the sort of public relations and customer relations downside, my sense would be you wouldn't be doing it, not for your guests anyway. So with that, Katie, do you have any other observations on any of the liability stuff we've talked about, or anything else before we wrap up?
I can, in 2 minutes, I think I can answer the 3 questions that are pending, and that way we could address those. I see there's a question about how contact tracing works between the states. You know, an employee who tests in one state and works in another state. I don't know the answer to that, other than that I'm quite confident that the state CDCs are working with each other to communicate, but I can't provide more around that one. There's a question about the FMLA or the FFCRA. I talked about how an employee only needs to have worked for you for 30 calendar days before they'll be eligible for that expanded FMLA. And the question is that 30 days of work, or will it be triggered for somebody who works 1 day a week for 4 weeks, essentially? And the answer is it will be triggered for the person who works 1 day a week for 30 days, you know, over a 30-day period. It's 30 days of employment, not 30 days of work. And then finally, there's a question, what about an employee who has not been honest about their symptoms to get a day off? You know, they stayed home and offered to pay them to go to a doctor. An employee isn't going to be eligible for paid sick leave under the FFCRA unless they're actually seeking a diagnosis. So there's not an obligation to pay them for that day off. If you have reasons to believe that the employee is not being truthful about their symptoms, then you might want to have, and if it's like COVID-related symptoms, so that it's triggering a quarantine obligation, I think it's sort of fact specific, but you might want to involve that employee's doctor. You might want to treat that as an FMLA situation and sort of put it to them to get some documentation. Those are my kind of quick thoughts. And I don't have any other last words beyond that. A lot of content.
Okay, well, thank you, Katie. Thank you very much. And thanks to all of you for joining us this morning. If you have other questions that are prompted by what you've heard, you should certainly feel free to reach out to either one of us, and we'll see that they get answered. You know, obviously hospitality is a sector of the economy maybe the most impacted by this pandemic. And but you folks represent the best of what Maine is, which is resilient, practical, and persistent. And we hope the information you've gotten today can be of some help to you in being those things. Here we are at the height of your summer season, and we wish you all the best in that regard. This webinar and the template infectious disease preparedness and response plan and the slide deck associated with this program will all be posted to our website shortly. And it's my understanding that Hospitality Maine is also going to make them available. And as we've recorded this, so you can listen to it again, or you can tell someone else about it, and it'll be available on either of those locations. So with that, we'll thank you all very much for your time and attention, and wish you all the best, and have a great weekend.
Thank you.